Hello, my name is Pamela Christian, RN, BSN student at Mississippi University for Women. Presentation today on the opiate epidemic in America. By the end of my presentation, my audience will know what opiates are, the definition of opiates, signs and symptoms of opiate abuse, how opiates have financially impacted America, and how we can combat opiate abuse in America. What are opiates? Opiates are drugs that bind and act on receptor sites in the brain to relieve pain and also create a euphoric feeling. They are prescribed to treat moderate to severe pain. Some examples of opiates are hydrocodone, oxycodone, oxycontin, fentanyl, morphine, and heroin. Statistics of the opiate epidemic in America. In the early 1990s, the big pharmaceutical companies convinced the medical doctors that opiate drugs were good for treating moderate to severe pain. They also told the doctors that they were non-addictive, which would cause them to be prescribed at an alarmingly high rate, which in turn created what we now are in, the opiate epidemic. In 2016, over 40,000 deaths were attributed to the opiate epidemic alone. How the opiate epidemic has had a financial impact on America. The opiate epidemic has cost the economy at least $631 billion from 2015 to 2018. The CDC estimates that the total economic burden of opiate abuse is $78.5 million a year. The epidemic has resulted in higher financial costs on the healthcare system, draining resources through our first responders, higher impact on medical visits through the ER, also requiring additional training on opiate overdose. The impact of the epidemic on the health care industry. All costs creating a burden on the workplace, healthcare, and the criminal justice system. Creating an increase in resources related to healthcare, creating a trending increase in healthcare related expenses. Resulting in more emergency room visits, outpatient visits, and inpatient visits as well. Signs and symptoms of opiate abuse in healthcare workers. Unable to focus. Increase in being tardy or callings. Decrease in productivity levels. Increase in errors. Poor clinical performance. Change in work ethic. Decrease in response to patient needs. Being off the floor for unexplainable lengths of times. Signs and symptoms of opiate abuse in non-healthcare personnel. Decreased motor skills and poor coordination. Constrictive pupils. GI symptoms. Nausea, vomiting, diarrhea. Sores all over the body, possibly from IV drug use. Weight loss. New friends and isolation from old family members and friends. Different ways my organization, Regional 1, is using to combat the epidemic. Educating the families on signs and symptoms of opiate abuse. excuse me, looking into other options for treatment of pain. Following treatment protocols as ordered and per the guidelines now in place to monitor the prescription of opiates. Making sure the patient understands and knows what their options are for their treatment plan, and make sure that you meet with them regularly to follow up to manage their pain medication and make sure that the medication is doing what it's prescribed to do. Various ways Regional One Trauma Center is combating this epidemic. Promoting safe and strong disposal of opiates and all medications. Standing orders of Narcan whenever opiates are prescribed. Ending stigmas of drug addiction. Always providing education on pain disorders and substance abuse disorders. Opiates and treatment. Detox. Removing the medications from your body, whether it be at home or in an inpatient setting. Inpatient, where the patient can receive treatment for the opiate abuse in a clinical setting as opposed to home. Time frames may vary depending on insurance and medical needs as well. Outpatient, the patient is medically stable to come and go backwards and forward, and they set up a treatment plan to come backwards and forward to receive treatment. Self-help. Some people actually do it on their own. Cold turkey. What am I doing to make a difference in the epidemic? I will always be supportive and compassionate to my patients. Never become judgmental. Understand that this person, in spite of the disease, is still a person. And always be a patient advocate first and foremost.